A short supply of talent, increased competition from larger healthcare employers, growing community care needs. Community health centers face many workforce challenges, but targeted brand communication strategies are helping them reach candidates in new ways. Welcome to the Adlibber podcast, featuring conversations of influence, some of it planned, much of it ad-libbed.
Welcome back to the Adlibber podcast, where we discuss digital marketing and brand strategy topics and have conversations with influential people. I'm your host, Jay Scott, Senior Account Director on the Public Relations team at Gavin. Today, we're talking how community health centers can leverage brand communications and marketing campaigns to support targeted workforce recruitment initiatives. Joining me today are Judd Mellinger-Blouch, Director of the Pennsylvania Primary Care Career Center, a nonprofit organization that recruits for community health centers across Pennsylvania, and Mandy Arnold, President and CEO of Gavin. Gavin works with health and human service organizations across Pennsylvania on patient and service marketing, as well as talent recruitment campaigns. Thank you for both being on the Adlibber.
Yeah, thank
Sure.
you.
Let's jump into it. We know workforce shortages have hit nearly every sector of the economy, especially tough to recruit in the healthcare sector and organizations that help the underserved. Judd, tell us a little bit more about the challenges that healthcare organizations face now in terms of talent recruitment.
Sure, Jay. Yeah, and I was thinking about this question. I think it boils down to, for us at least, with community health centers, and I think it holds true throughout the healthcare industry, is there's three basic issues that we're facing right now. One is supply. They're just, and you can look at any level of employee that we're talking about in a hospital system or with a community health center, from the highly educated neurosurgeons to folks coming right out of high school or a trade school. There just aren't enough physicians, nurses, medical assistants, and so forth to meet the need. And it's because of that supply, it kind of leads to the second issue, which is competition. And there's a huge amount of competition between healthcare employers for these people. And one of the problems that we have on our end, being small and nonprofit organizations, for the most part, our organizations have employees probably a large organization, for instance, would have 600 employees. That's the largest organization we have. Others have less than 100. And so when you're competing with huge health systems like Geisinger, UPMC, Penn, and so forth, you're just going to be at a disadvantage in those situations. And that's just the way the market works. So the competition issue. And then I think the third issue is the work we do throughout healthcare is not the easiest work. It's extremely rewarding. There's a lot of advancement and career opportunities in healthcare, but it's not easy. Particularly we saw, the Great Resignation happen after, we're not after the pandemic, we're still in it, but 2019, 2020, a lot of people kind of got scared away from healthcare because of the work and the risk and so forth. So we see people coming back now, but it still is it's a difficult industry to be in and to meet those needs, particularly in our underserved and rural communities.
You mentioned this, the competition, the size of some of the organizations, 600, less than 100. What do you think drives someone to apply for an opportunity with one organization over another? Like, what are those recruits looking for when they're, saying this is a smaller, more boutique-y size organization, or, a larger health system or opportunity that I might have in Pennsylvania? Like, what are the things that drives them to apply to one versus the other?
Right. Well, I think, and we're going to get to this, I know, a lot throughout here, but I think there is various healthcare organizations, and I can think of, for instance, in Pittsburgh and Philly, there are a number of fairly qualified health centers, community health centers in those towns, and each of them has their own brand. Each of them has their own feel. And I know I can tell you which ones have more success recruiting and which ones don't. And it does go somewhat to the brand and the feel for that. Now, I think that extends also in healthcare, particularly when we're talking about your higher paid revenue producing professions like physicians, dentists, licensed clinical social workers, nurse practitioners, and so forth. I think there's a real network of opinion. There's opinion leaders in those organizations. There's mentors of physicians and dentists and so forth. And so much of it depends on on what that opinion leader, how they feel about the brand of an organization. I can think of a gentleman, one of the faculty members at Pitt Dental School, and he is a big supporter of community health centers. He's seen the quality that we provide. He's seen, and he's a big supporter of dental care for low income and underserved populations. And he's influenced a number of Pitt dental students to go and work in community health centers or to work in a private business or something in an underserved area. But at other places, they're more influenced, the physicians, dentists, and so forth, to go work, stay in the health system where they're being trained, or to stay in a larger organization. So a lot of it has to do with that reputation, and it goes back to brand. And how do we help our members build that brand that some of our members really enjoy, a fantastic brand with candidates, and others don't have that. And so I think that's a tremendous thing. The tendency is to say it's salary and benefits, it's money, but we're also seeing that a lot of people are putting much more emphasis, particularly millennials, on quality of life, time. How much time? One of the first questions you get is, how much time off do I get? And I'm an old guy. I never would have asked that question in an interview. I wouldn't have thought of asking that question because I would have taken what I got, and I would have been out the door. Quite frankly, if my first question would be, how much time do I get off? I wouldn't have been hired. So, but that's the generational difference, and that's what we need to work with and understand. We can't change that, so we need to work with it.
Good segue. I mean, Mandy, thinking about it from the brand communication side, as far as what influences talent recruitment strategies today, a little bit differently than in the past. I mean, we're kind of, talking about brand a lot. Can you speak to it from that perspective? Like, how do those communications efforts, how do we build on them to develop targeted recruitment strategies a little bit differently now in 2022 than maybe, say, 5-10 years ago?
Yeah, no, absolutely. Thanks, Jay. Judd makes excellent points. The landscape has really changed through COVID. The pandemic not only brought to light a lot of the challenges in recruitment because of the capacity issues, the supply issues, but now the perspective of talent, what they're looking for is really, this work-life balance. And so they are looking for how their relationship with their employer is very different than it was pre-COVID. So a perfect example of that in relation to brand is that brand goes beyond just a logo or a mark. It really is the complete story of culture, organizational values, and what the unique proposition is to the employee and to those that they're servicing. I think community health centers have been able to take advantage of the environment where their story is finally being told. I think people often misunderstood community health centers and FQHCs. And so now we have this platform where we can talk about community health centers and their organizational brands in a different way, where the talent are seeking what they have to offer. They're looking for something that they can connect to passionately, make a difference in their community. They want greater flexibility, not only in benefits, but also in their work-life balance. And community health centers bring that very distinctly to the market that is different from large healthcare systems. And so brand then becomes the tool that we use to tell that story. And so when we talk about brand, we certainly mean this kind of universal omni-channel voice of what is it like to work for a community health center? What is it like to make a difference in my community? And what is the benefits that I get as an employee, as a teammate in my work-life balance goals? So that, I think, as a marketer, we absolutely are looking at brand in a different way with workforce development, to the points that Judd made, and then also just this new talent, expectation.
Right. And this is for both of you. I mean, thinking about the history of some of the tactics, obviously a lot more digital marketing, a lot of other, alternative means in which to reach those recruits today than maybe in the past, more traditional, print and other tactics we would have taken. Can you speak a little bit to that, Judd, maybe from your perspective, and Mandy can certainly follow up on how that's changed?
When I look for a job, you got the Sunday paper and you open it up to the one ad section, and just about every job was in there. It was all very centralized, and I'd like to say it's easy. It was easy, but it was very confined, and so now there's so many more possibilities about getting the word out. It's also, the audience is also very spread out, and and some people are on one social media platform, some people are another. That's why it's so important to hit as many as you can and to make that positive impression. I think a lot of it too is we're trying to work with our health centers, and we're trying to get our own minds around this, that hiring isn't something that you do when a job opens up. Hiring, recruiting is something you do 365 days a year. Maybe not 24 hours a day, but 365 days a year. And because you're always putting seeds into the ground for the future. And that's something that's, people want to go out, they have a job open, they want to go out and hire somebody. Well, if you haven't built that brand, if you haven't built your reputation, if you haven't sown those seeds, it's just going to be so much harder to do it, to go out and make that happen. And some of the things we're seeing right now, pipelines and pathways to careers in healthcare, people are finally getting that through. And, we're seeing new schools of medicine being formed with the goals of training recruits, training physicians for rural and underserved areas. And so you see that those kind of things happening, and people finally getting that idea that this is year-round, work to be done. And you can't do that. That's one of the things that we want to make sure we do with this marketing campaign, is that it has legs. Somehow it continues in the future. So that's a conversation we need to have going forward in our organization about how do we continue this going forward.
Yeah. And Jay, to build upon what Judd was mentioning, certainly times have changed, but we always see these ebbs and flows, digital, traditional media. And I think that we now really see this shift where digital is merging in with traditional. So perfect examples of that, the digital screens, the programmatic advertising, in C-stores and doctors' offices, and, on screens that we may not have had access to before. And so we're just looking really to create this surround sound effect around target audiences. And data, data is always shifting, in terms of not only how we're able to use data, but the data that's available to us. But data has absolutely opened up our clients' perspectives on how do I become a better marketer in reaching target audiences, especially talent. So now we're digging deeper into rural communities because we've got a multitude of screens in addition to digital. So we better understand, what do people respond to? And I think now employers are tapping into that information with us and saying, okay, what's important to an audience over here in the western part of the state? What's important maybe in the south central part of the state? And we start to create really customized marketing to differentiate each community health center or each organization that is trying to hire. So to Judd's point, everyone has a different story depending upon where they are. They have their own unique brand. And the new forms of advertising provide the platform to reach all those audiences, but also be distinct in the relationship because of the types of media we have access to now. So I think the future is going to be really interesting in recruitment. And as Judd mentioned, it's very noisy. So the more data that you can better understand and enhance your message and customize it to your audience and your own brand message, the more effective you're going to be.
Yeah, that's a good point. And we're talking about the diversified channels and differentiating, but can you speak a little bit more, Mandy, to like the kind of the core of the community health centers recruitment strategies? Like you have to identify the base in which to build around, and then obviously you can customize the stories accordingly in different markets. But where do you find that core message, that core story to build out a broader campaign across, say, Pennsylvania or regionally?
Sure. I think the biggest part is really getting to that major overarching umbrella message of what is the most relevant to all of these partners in this universe. And so for Judd and the Pennsylvania Primary Care Career Center, they represent more than 300 locations across the state. So trying to really distill that into one message, we just identified that we are all focused on making sure that we're driven by passion in delivering the care to our communities. And so that the word that kept coming up was love, and we realized that, people really do want to earn a living where their heart is. And so once we really massaged that, it turned into this beautiful campaign that has been embraced by all of the community health centers, which has been really exciting for us. And then working with them to allow them to customize that message in their local markets so that they take their personal story to their local community to start to recruit talent. But the intention behind the Earn a Living Where Your Heart Is campaign is to build this concentrated message so that everyone better understands what a community health center is, so that they are seen in a different light in this kind of really highlighted or environment in comparison to a lot of the competition. As Judd mentioned, when you are competing against a 25,000 person health system and you have a 600 person organization, sometimes employees can see that as, oh, well, maybe I'm going to get better benefits with the big organization. Maybe we're going to get better this and better that. And we kind of said, no, we've got to reframe this story. And so we built out all the tools and resources to highlight those key points of differentiation of what it's like to work for a community health center. And that was the strategy. And I think if you are someone building a campaign, that's where you have to start. How do I really stand out in a very, very noisy marketplace? Because everybody's recruiting. Everyone, especially in healthcare. It's not showing any signs of stopping based on the forecasted demand. So you have to start really at that. What is distinct about us, and think of how you say it differently with a voice that empowers, right, your team, that they take great pride in it. And I think that's what's so special about this campaign that was created, is you just see their faces light up when they see the Earn a Living Where Your Heart Is. And then they see the follow-up headlines of, follow me to a job that loves you back, that kind of thing. And it's very exciting. It's really exciting. So very excited to see all the health centers implement it.
Yeah, there's a lot of impact, like very visually striking campaign there, and certainly very customizable communications and messaging that goes along with it. It touches a lot of people in a different way. I'm hoping, maybe Judd, you could speak briefly to that as far as, this campaign obviously has been in development for a while, and it's, now you're starting to, see people respond to various components to it. I'm sure you are as well. Talk a bit about how it kind of came together, what resonated with you, and then we can certainly get into some of the campaign goals that Mandy can speak to.
Sure. This was a very, some good things came out of the COVID pandemic, and one was increased funding for vaccine hesitancy to try to get more people to work in community health centers and underserved populations to increase the rate of vaccines. And so one of the things that came out of this was, well, we obviously need to do something to recruit more people to work in community health centers, and really a once in a lifetime amount of money. That's why we need to find a way to give it some legs. And we knew that, we worked with Gavin before. It came together by sitting down with Mandy and some other folks on the Gavin staff who already had a really good understanding of community health centers, and talking through why it is that people want to work in a community health center. And when they came back with Earn a Living Where Your Heart Is, I've been in marketing and stuff for a while, and it's the first time I've ever looked at a slogan, whatever you want to call it, the first time back, and said, oh my gosh, that's it. And that's the reaction we get. And it really, not only is it going to work for recruiting, it's working right now for retention, because it's helping people put into words how they feel about working in a community health center. Most people, everybody has their gifts, but most people are not gifted with with developing these kind of slogans or really getting it to the heart of a matter in just a few words. And that's what happened. And you see people, Mandy's exactly right. You see people's faces light up when they see this. So, our goal now is to make sure that all of our health centers use this in some way, shape, or form. And this is not something short term for us. Our whole website got rebuilt with this slogan and with this whole brand. And so we're very excited about that and continuing that.
Judd touched on this, obviously some of the, way the campaign came together, but speak to some of the early goals and how we kind of take persona development and start to build up to where we're at. And then what are we trying to achieve here?
I will say you brought up persona development, Jay, and that is one of the things. Once we landed on this, aha moment of the campaign, we realized, okay, but that's different for different people based upon all these different roles that we're hiring for, because how we recruit someone in the direct community is going to be different than trying to draw someone 3 states away to relocate to that area to work. So then we started to take a look at, well, what does that mean? How is that relatable to each kind of one of these levels of roles, and building out a specific message and approach to engaging them. And then the goals became, one, are we standing out in the marketplace to differentiate community health centers, period? Are we getting them the attention that they need to provide a platform to get people to pay closer attention to them? And then the other part is the tactical execution, which this is a very digitally heavy campaign, in addition to traditional face-to-face marketing, lots of event tools, lots of public relations, but taking the message to each one of those audiences that we've identified and then tracking those analytics very closely. So watching the conversion rates, watching what people respond to more, right down to colors, messages, imagery, how they interact on the website to actually apply. So then that second one is getting them to interact with the brand, to actually engage and click. And then finally, the goal is applications. So, we worked very closely with Judd's team when we built the website to make sure that those tracking analytics were as deep as we could get them. We worked with 3RNet, their partner that does all of the actual job postings. And so the kudos to our digital team who really thought through that entire journey, and working closely with Judd on what that would look like for reporting. And now we're working with each community health center to make sure their websites are higher functioning, because we don't want to do all this investment, get people to a website, and then they don't know how to apply, or it's too complicated to apply. So I would say those were kind of the big three goals: certainly elevating market awareness and differentiation, getting target audiences to engage with the campaign, to start to initiate the process, and then 3, to get people to apply for the job. And then from there, it's up to Judd's team and the community health centers to, make sure that they're hiring and qualifying people.
Right. If you're looking to start something like this, where do you begin a campaign like that? We talk about goals, we talk about how it kind of came together here with Judd's team, but if someone else we're looking to do something similar, where do you begin, Mandy? Like where does that process have to start, or how long of a process is it really to start, putting the building blocks in place for a campaign like this?
Yeah. Now, keeping in mind, this is a statewide campaign for 300 community health centers plus, trying to recruit thousands of people. So, I think that depending upon the investment that you're making and how much you have at stake, certainly that's going to require some more lead time. I mean, I think, Judd, we spent probably about 4 or 5 months building the campaign, getting all the assets, but then also working with the community health centers to let them know this was coming. I think if you are a smaller organization or you have smaller recruitment goals, I think you're going to need a month or 2 to put something together. If you are a large organization and you have more at stake, I think you want to spend a bit more time making sure that a hiring campaign is really part of your overall branding strategy. And that's what this is for Judd and his team and the community health centers, because you're going to put massive investments into recruiting. I mean, today it's employers' biggest pain point. So why not make it part of your overall branding strategy? And that goes beyond kind of the implementation with traditional and digital media, but also think about public relations and storytelling and internal communications. How are you getting your employees excited? Judd mentioned, it being a retention strategy. So there's a lot of other factors beyond just, I need somebody to apply for a job. And I think every company and brand needs to figure out, okay, what do we truly want out of this? What's the investment we're making? And how important is it right now?
Right. That's a good point. I mean, Judd, we're talking a lot about brand, about communications, a lot of marketing items, but this is a workforce initiative. This is about jobs. This is about, the economy essentially, and how we're, kind of building out, from some of the strategies and tactics that are being put into place around campaigns such as this. What do you think can be learned from this initiative? I mean, there's still a long runway ahead, but this is essentially something else you can build from. You can learn from this campaign to do other things as an organization that's serving, folks all over Pennsylvania. Like, what are you seeing that you can learn from it right now, and how do you think that will kind of morph over the next year or so?
Well, that's a really good question, and I think we're just starting to kind of scratch the surface of what we're learning from this. But I think one, and we've talked a little bit about it, it's if you want to do this, it requires resources. And so how do we get those resources? How are we able to tap into the skills of somebody like an organization like Gavin and somebody like Mandy and your whole team? And that requires some sort of resources to do that. And this isn't going to turn around just because we wish it's going to, or because we think people are going to flock to us out of the goodness of their hearts. This requires an investment not only on a statewide level, but on a federal level. And so I think there's a realization of that. And so one of the things we're also going to learn from this is how to show that it was successful. And that's with the data that Mandy was talking about earlier. And folks like you help folks like me understand what that data means and helping to communicate that to other people. Because in a nonprofit world, I have a board, I have a boss, and she has a board that she reports to, that they're going to want to know why this was successful. So, and in the past, I can tell you one of the things in the past with recruiting was it was hard to draw a straight line between an effort and a result and say, this was because I got this hire because I did X, Y, Z to do it. And I think you can do that much better now than you could before. And so some of that's some of the learning. And some of it also is, through the developing the personas, through talking with more employers and that sort of thing, we're really learning why people want to work in a community health center. I've never worked in a community health center. I work for their organization, but I've never worked in a community health center. So why is it that somebody wants to work there? And not just going to the people who, we have two basic groups of people who work in a community health center. One is the people who have to work there because they need to get loan repayment or they need a special visa to stay in the United States or something like that. The other are the people who want to work there. And so this group of people who want to work there, why are they there? Why do they stay there? And I think we've started to get at that. And then it's different in every organization. Some people stay because there's, if you're in a rural area, you might be staying there because it's the only employer around. If you're in an urban area, why are you staying there when you could be working for Pinnacle or Penn or UPMC or whatever? And I think we're starting to scratch that surface and really get down to that. And then we can use that to refine this marketing campaign and to build it out in the future.
Mandy, what are you forecasting for 2023? How do you expect this kind of campaign to evolve, or what other work will it influence as we think about brand communications initiatives that, community health centers all over are going to be looking to employ next year?
Yeah, I think, for the first time, the HR department is involved in reviewing all these analytics in a different way. So now we've got bringing marketing, the executive team, and HR together because there's so much at stake. And I think that that's going to change the conversation about how we make all the parts and pieces work together. I think this is probably the first time where we've seen clients really rethink, okay, hold on. If we're doing this, all of a sudden now, what we were talking about earlier, our brand is important. This is important. How do we talk about this? How do we tell our story? So all the parts and pieces are going to work better together. On the tactical side, I think we're going to have to really navigate the challenges with data. Everyone's trying to leverage data as best they can, and it's all through mostly third-party platforms. And so we know that those changes are coming at us. And so we're trying to figure out, what do we do to continue the success that we're seeing? But what if we don't have access to all that data anymore, or limited amounts of data? So I think we're going to have to really dig in and work with clients on their first party data. What are they collecting? What do they know about their organizations across the board? What do we need to do to engage employees differently, or even potential hires differently, where they might be signing up for different stuff, email, newsletters, to get to know the organization? And so I think we're going to have to get really creative. And then I would say the final part is never underestimate traditional and how traditional is changing. We're looking at right now doing some really interesting targeted market campaigns toward providers that we know are harder to reach in very unique formats. And I think, we're really excited about what we're going to be doing, because we're coming back to the client and saying, hey, don't take traditional off the table. Let's look at this. We think we might be able to do some fun stuff and really stand out in the marketplace. So I think that those are some big things for 2023 to keep your eyes on.
Final points. What do you think, what should be the number one recommendation for anyone that's dealing with talent recruitment in this competitive labor market? If they're not looking at these items comprehensively, but they're looking at it, what's your top recommendation, Mandy, for what they should be doing?
The top recommendation, I think, is just continuing to understand data, continuing to make sure all of their owned resources are working hard for them, making sure they're investing in their website, making sure they're understanding public relations. So I think making sure all those parts and pieces are working together.
Judd?
Well, I think kind of building on that is one of the things with data and so forth is to be strategic, to step back and take the time to look at your workforce issues and, for your community health center or for whatever employer you're with, and develop a strategy on how you're going to move forward. Where's your organization headed, and who are you going to need to bring in and recruit, and how are you going to do that, rather than just living, day to day, hand to mouth with the employees. And part of that strategy is, how do you build your brand? How do you build your reputation as an employer of choice? And if you don't stop and do that, it's not going to happen. It's just not going to happen. And that's a tough thing to do for people who are just trying to keep the doors open and keep things moving, but it's necessary.
Judd and Mandy, we appreciate you joining us on the Adlibber and helping our listeners learn a little more about the current recruitment challenges facing community health centers and the brand communication strategies you are implementing across Pennsylvania.
Yeah,
Thank you.
Thank you for listening to the Adlibber podcast. To find new episodes and get more content from our team here at Gavin, make sure to visit our website at adlibberpodcast.com. The Adlibber is also available on Spotify and Apple Podcasts.